and welcome to the second day of the Congress. There's a fantastic program that we have prepared for you today, and I'm sure you will all enjoy it. I would like to thank all the organisers, Dr. Mustafa Mosawi, for all the invitations, and welcome to our distinguished speakers this morning, who I see ready to give their presentations. So, without further ado, I would like to introduce the first speaker, Dr. Mohsen Ali Akbarian, who I understand is a transplant surgeon in Mashhad in Iran. And he will speak to us about artificial intelligence in organ transplantation. And thank you very much. We look forward to your talk.
Good morning, ladies and gentlemen. First of all, I would like to thank the organizing committee for this prestigious Congress and also for the invitation. My talk is about the role of artificial intelligence in transplantation. You know, AI is a branch of computer science that uses computational models to perform tasks that previously required human intelligence. It has some subsets, but the most important are machine learning and deep learning. As you know, machine learning enables systems to learn from data and improve itself. And deep learning uses different levels of neural networks for process complex data, including imaging and other inputs. One of the most important roles of artificial intelligence in transplantation is donor-recipient matching. It enhances the likelihood of successful transplantation. It reduces the waiting time, at mitigating the risks associated with prolonged organ failure, primary non-function, and rejection, and it improves the real-time matching. As you know, in traditional algorithms, we'll be able to use some small amounts of variables, like blood type and HLA. But in machine learning algorithms, we're able to use maybe thousands of variables to use for interpretation, including donor, recipient, age, medical history, genetic profiles, prior transplant history, immunological markers, lifestyle factors, and exposure to infectious agents. One important role is immunologic matching. You know, previously we used 0, 1, 2 mismatch HLA in donor recipient, but now AI help us to improve HLA matching at the level of epitopes and predicting immunogenicity of specific HLA alleles. Also, it can help us to predict donor-specific antibody formation, a virtual cross-match optimization, and optimize donor-recipient allocation. And also, it can help us to integration of molecular, structural, genomic, and clinical data. AI can help us to predict the graft survival that is very important for the final outcome of the transplantation. Machine learning models use extensive data, including conventional clinical parameters, genetic information, biomarkers, social determinants of health, preoperative donor-recipient data, intraoperative and post-operative variables. As you know, the KDR, that is a traditional model, has a C-index of 0.6 for predicting the graft survival, but using AI models, this prediction would be much better. These are some of the algorithms that are currently created by different centers all over the world for prediction of the graft survival, as you see, from UNOS OPTN, from United Kingdom, from Germany, and from Korean registry. And they have increased the value of graft prediction. It can optimize organ allocation. A smart match platform reduces organ discard rates and minimizes the cold ischemia time. AI can help us to optimize organ allocation. An example is Eurotransplant's AI enhanced allocation system that is currently in practice, and it has improved utilization of marginal donors. The AI can predict graft survival and so better matching. It can improve immunologic compatibility, so we would have less rejection. It can reduce discard rates, and so more transplants we can do. It can optimize fairness and survival. It can simulate policy changes. It can support real-time clinical decisions, so faster decisions and safer acceptance. It can uses machine perfusion data and expand the organ pool. And also, it enhances the logistics, so shorter cold ischemia time. This system, AI-based system, evaluates which patient will live longest with this organ. What is the mortality risk if they don't get it? And how much survival benefit does this organ deliver to this specific recipient? One of the most important factors in dynamic organ ranking systems using live recipient and donor data instead of old data. It can predict the outcome differential for each candidate, and it can generate a real-time personalized ranking of who would benefit most of this organ. Also, robotic-assisted transplant surgeries, that dramatically has increased the precision of the operations. And AI-powered image analysis can help the surgeons intraoperatively. There are advanced devices. AI-enabled normothermic machine perfusion. In some cases, automatic machines can increase the viability of the organs and reduce the discard rates. About the post-transplant care and immunosuppression management, the AI-based algorithms can predict the rejection risk, and also it can forecast medication bioavailability that can help us in prescribe individualized medicines. Digital pathology, we can use AI for interpretation of the biopsy specimens. It reduces the inter-observer variability, and it would increase the speed of judgment for the biopsies. This application, MAVIS, can help the liver surgeons to use the data before operation and intraoperatively. For example, preoperative image processing can estimate the volume of the liver and the portal vein area-based territories, arterial, hepatic vein, and you can plan the surgery according to this application. For example, for right hepatectomy, it shows you the volume of the right lobe, the left lobe, and also the inflow territories and the outflow territories, and even post-surgical evaluation, 1.5 months after operation, you can see the size and the shape of the remnant liver for the recipient and for the donor. Using AI models, we can reduce organ discard rate as much as 15%, shorter ischemia time as much as 20%, and lower ejection rates as much as 25%. AI models can predict the risk of organ rejection with evaluating the compatibility between donor and recipient at a molecular level, assessing genetic markers that indicate potential immune conflicts. It provides real-time risk assessments by continuous monitoring and enabling targeted immunosuppression that is so important for reducing the complication of immunosuppression. It can assess the risk of infections, which patients are at higher risk of infections. It can enable us to prescribe targeted prophylactic and therapeutic antibiotics. It can analyze genetic predisposition of some patients to special infections. Also, AI can help us in operational efficiency and resource optimization. It can predict organ demand accurately in the scheduling surgeries in the operating theater, automating routine administrative tasks, and analyzing patterns of seasonal variations in donation and maybe the need for organs. But about the future directions and opportunities, personalized medicine and precision immunosuppression is very important to prescribe a special immunosuppression antibiotics for special patients. Fully automated organ viability assessment during perfusion can help us to increase the donor pool. Advancement in robotic surgery associated robotic vascular anastomosis, AI-driven remote monitoring systems, and integrated HPV transplant decision support systems. Also, autonomous surgery, fully autonomous robotic surgical systems are emerging. And telemedicine is another opportunity with AI. But there are some challenges and considerations. Data quality and bias, with huge amount of data, probably we'll have some missing values, some heterogeneous coding, and collecting data over changing protocols that's maybe confusing for the machines to interpret. Another challenge is black box. We have an input and output, but we don't have any information about the inside of the black box. So the procedure or the phenomena, and it is to some extent vague. About the regulation and validation in different countries, there are different regulations. Is to some extent difficult for integration into workflow, and the responsibility, if there is any mistake, who is responsible for the mistake? The AI, the company, the physician. And about the data privacy, there are some concerns, and about the public accessibility. In summary,